It's wonderful for you all to be with us. We've got a fantastic addition to our metabolic health work this evening with Dr. Erin Bellamy. Erin is a psychologist by background, but now spends her time focused on really supporting people's physical and mental health, importantly, with metabolic health interventions. I've heard Erin speak a couple of times, and I'm sure what you're about to hear now is totally fascinating. The world of mental health and what helps mental health is changing rapidly. And with that, there's a lot of hope that we can help our own and others' mental health improve quite significantly in ways that you may not have heard of before. So, Erin, over to you to share your fantastic wisdom with us.
Thank you, Campbell. I appreciate that. Hi to everybody listening. Hopefully you will find this fascinating. I know that I sure did, and I'm going to share with you a little bit of background about how I got here as well as where we're going. So firstly, we're going to talk about ketogenic metabolic therapy for mental health. This is probably a term that you are not familiar with, and if you're not familiar with it, that's okay. It's new. Integrative Ketogenic Research and Therapies is my private company, and this is a little bit about me, which I won't go through, but you can read in your own time. The most important thing here is just to say that I don't receive any funding for any of my research, and if you do want to find out more about me, you can just put me into Google, and you can find out a little bit more about me online. Okay, so when I was thinking about putting this together, I thought a little bit about, what your understanding of a ketogenic diet would be and where you guys are kind of coming from. And if I think about mainstream media and I think about type 2 diabetes, obesity, metabolic syndrome, this is often where people come across the term ketogenic diet for the first time. And so I'm going to bridge your knowledge, hopefully, with where we are going with mental health with ketogenic metabolic therapy. So just to go back to ketogenic diet in general, what is a ketogenic diet? It's a very fancy word, doesn't really make sense. It's not like vegetarian or vegan where you can kind of make sense of that when you hear it for the first time. But when we think about what that looks like on a plate, we're thinking about low carbohydrate foods, so technically less than 20 grams per day, moderate protein, and high fat. So essentially what we're doing here is we are taking the food pyramid that everybody here will have seen many times before, and we're turning it upside down. So instead of having carbohydrates on the bottom of the food pyramid, where it is in abundance, we are switching that and putting the carbohydrates at the top and having those in very small amounts and moving the fat down to the bottom. So the majority of your plate becomes fat, then protein, and then carbohydrates. And so what are the functions here? When we're thinking about carbohydrates, the reason why we are reducing these down so low is to induce a state of ketosis. Now, you might be thinking, I don't even know what a carbohydrate is. Well, carbohydrates would be things like breads, pastas, rice, anything beige most of the time, chips, crisps, and then of course things like sugars and biscuits and cakes and so on. So anything that's a starch or a sugar is a carbohydrate. And so when we reduce those levels in our diet down to less than 20 grams per day, we can move into something called ketosis. And this is where the word ketogenic diet comes from. It's from this state of ketosis. The term ketosis simply means moving our bodies from burning sugar and carbohydrates, which if we're eating to the food pyramid, we're eating that way every day and we're running our body on carbohydrates and sugar. So we're going to move from that over to using fat and ketones as an energy source. So that high fat that you see in the formulation, we're going to move over to using fat as our main source of energy, and we are pushing ourselves into a state called ketosis. The protein that we have here just simply covers our protein needs. And the fat that we have, it's very high fat. It supports ketone production, which is a source of energy. It gives us energy to the body and brain. Now, in the mainstream media, you have probably come across ketogenic diet for things like rapid weight loss. I think plastered across many magazines, it said so-and-so has lost tens of pounds on a ketogenic diet. So yes, it can be used for weight loss and for fat loss, but also there's a lot of good research coming through now, and for almost a decade actually, on using low carbohydrate and ketogenic diets for type 2 diabetes and pre-diabetes. And there are many other uses for a ketogenic diet too. And of course, we're going to talk about mental health specifically in a moment. So that's a little background on the ketogenic diet itself. So what's the difference between that and ketogenic metabolic therapy, right? This tongue twister, what is the difference between the two? Well, that state of ketosis that I mentioned to you, where you switch from using carbohydrates and sugar as your main energy source over to using fat and ketones, this can be deemed a therapeutic nutritional intervention if implemented correctly and taken to a specific level. So when we think about the ketogenic diet, not all ketogenic diets are the same. And so ketogenic metabolic therapy is not the same as a keto diet for weight loss. Okay, and on the right-hand side here, you can see the breakdown of 4 different types of ketogenic diets. So the top left-hand side, the classic KD, this is a ketogenic diet that has been developed to treat childhood treatment-resistant epilepsy. And so you can see there, the circle is predominantly blue. It's 90% fat and 7% protein and 3% carbs. The main takeaway there is just simply that's an awful lot of fat on the plate, but at that level, you can treat childhood epilepsy and you can prevent and you can stop seizures. And this has been used with epilepsy for over 100 years as a treatment. And so we have a ton of research to support this, and it's very safe if implemented correctly. But also, that's pretty restrictive, right? That's a lot of fat. The meal's probably not that enjoyable because you're not getting much protein or fat. Then if we look at the bottom right, the LGIT, the low glycemic index approach, you can see there's a lot more protein and carbohydrates allowed there. And this is also a ketogenic diet. All 4 of these are different types of ketogenic diets, and they're all used for different things. So the bottom right-hand side, for example, this can be used for treating migraines, and people who use this approach do really well with putting their migraines into remission. And so when we think about ketogenic metabolic therapy as a term, we are taking a ketogenic dietary approach. We are manipulating it in a way where we produce a certain amount of ketones, which are little molecules that can fuel the brain and the body. And depending on how many of those ketones we want, that corresponds with how the individual's symptoms respond. So that classic KD in the top left, that would produce or help you to produce a lot of ketones, and that amount of ketones can correspond with preventing and reducing and stopping seizures. The bottom right-hand side, that individual wouldn't need as many ketones, so they can be a little bit more lenient, but that diet is designed specifically for treating migraines and other things where ketones at a lesser level are necessary. So this as a therapy is very different to just a standard ketogenic diet. As I said earlier, it's also low risk if implemented correctly. You've probably heard a ton of things online like, oh, there's a risk of ketoacidosis, you can't do keto if you do this, or this person developed XYZ. Those things may be true. However, if implemented correctly and with the support and guidance of either a physician or if you've got some good resources, you can do this. There are a couple of contraindications, okay? In other words, there are some people that it might not be suitable for, but for the majority of people, this can be safe and effective if implemented correctly. So Based on this research that we've had for over 100 years, when we think about the epilepsy work, we have been thinking over the past maybe 10 or 15 years about maybe there's an interaction here, or maybe there is a possibility that this could work for other conditions. We know that there's some research to support the use of this with Parkinson's disease, with migraines, with early onset dementia, with cognition, and mental health has now become, there's a new field emerging, which is called metabolic psychiatry, which is looking at using ketogenic metabolic therapy specifically for mental health conditions and a whole range of mental health conditions. So taking a step back then, why is this important? Why would we be thinking about other ways to treat mental health and mental illness? Well, you can see my sad egg here. We have a bit of a problem, okay? And I think we probably could all agree with this. Back in 2018, so before COVID, only 12% of the USA were metabolically healthy, and the UK is not that far behind. Then we went through COVID and people's metabolic health got worse. So I would imagine that this percentage is even lower. Okay, which means we have 90+% of people who are not metabolically healthy, people who are struggling day to day. We also have 1 billion people who have a diagnosed mental health condition. So that can be anything from depression and anxiety, all the way up to schizophrenia, bipolar disorder, PTSD, and so on. Now, if you think about how the NHS is run and you think about how things get diagnosed in the UK and also globally, you probably know that not everybody who's struggling with their mental health has a diagnosis. So there are probably a couple of million, at least, other people who are undiagnosed, who are still struggling with anxiety, with panic, with intrusive thoughts, with depression, and they're just sub-threshold. Okay, so really, that 1 billion is probably much, much larger. When we think more specifically about conditions, so major depressive disorder or bipolar disorder, and the rates of these are going up at quite a rate these days. 30% of people with these conditions are treatment resistant. In other words, they have tried multiple medications and multiple interventions, and they are not getting better. So they might see a little bit of relief, but they are not getting fully better. So that leaves them wondering what to do next. Okay, how can they get up and do their day's work? How can they get up and be with their family and friends if they are struggling with these conditions? And 30% is quite a lot. On top of that, there are many medications that are metabolically damaging. So I'm talking specifically here about mental health medications. There are certain antidepressants and antipsychotics that will damage the metabolism. Now, mental health medications are absolutely life-saving in acute situations. They will save people's lives. I am not saying anything otherwise. What I am saying is long term, if somebody is on some of these medications, it does damage their metabolism, and it does reduce their life expectancy. And so we have to think about other ways to help people here. Yes, the medicines can be helpful. However, the offset is that it's damaging their metabolism. And so things like obesity, metabolic syndrome, pre-diabetes, type 2 diabetes, these are terms that you are all familiar with. All of these can come up as a result of taking some of these medications. So we do have to think about other things that we can do that can help people with either a diagnosed mental health condition or people who are just struggling day to day to get up and get out because of their persistent low mood or their anxiety. Now, thankfully, there is a growing research base right now looking specifically at the ketogenic diet, ketogenic metabolic therapy for many different psychiatric conditions. So things like anorexia nervosa and eating disorders, bipolar disorder, depression and anxiety, all the way up to binge eating disorder, for example. And thankfully, there's money behind it too, which means that the research is not stopping anytime soon. And so this is really quite an exciting time. It's showing that, perhaps there's another way that we can look at treating mental health conditions, even in adjunct alongside the current treatment plan. Perhaps there's another way that we can look after our mental health. And so alongside the papers that I just showed you, those titles, we have more than 12 clinical trials underway. Now, clinical trials are the gold standard when it comes to research. So most of the time, if you speak to your doctor, they will say, well, there are, I would recommend this because there are this many clinical trials, and I can say with confidence that this will work X, Y, Z. And we really need this level of research to suss out whether this can be helpful for people. And finally, we have those trials underway for all of these conditions. And so even including ADHD and autism. So again, if I take another step back, you're probably thinking, okay, well, this all sounds great, but who are you and what are you doing and how did you get into this? So I want to give you a little bit of background as to how I came about this area, and share with you some of my research and then some of the clinical insights that I have, along with some of the clinical insights from my colleagues, as to where this area is going. So I hope you don't mind my little gifts here. Going back about 10 years, I was working in the NHS as Dr. Murdoch said at the beginning. So I am a chartered psychologist. So I was working in the NHS to get some experience, and I was working on some inpatient psychiatric wards. And I was doing a night shift. And I was researching the ketogenic diet because the ketogenic diet at the time, there was research coming out to show that it was showing benefits for type 2 diabetes. And so I started having a look at this and digging deeper into the research, and I noticed a couple of things. So I noticed that the ketogenic diet was reducing blood glucose levels and stabilizing them. Now, this is exciting because many people are dealing with irregular and erratic blood sugar levels day to day without even knowing about it. So the ketogenic diet was doing that, and it was helping to put type 2 diabetes into remission. The interesting thing was some of those studies were also showing secondary improvements in mood. Yes, you might say, okay, well, if everybody's going to feel better if their type 2 diabetes was put into remission or if they lost loads of weight, that makes sense. Well, it does make sense. But they looked at this more closely and separated it from losing weight and from the type 2 diabetes going into remission. And they still saw that mood was improving and psychological well-being was improving. And I thought this was really interesting. I thought most of my patients on my ward have type 2 diabetes because they're taking a lot of medications that are metabolically damaging. And also, they're part of the 90+% of people that are metabolically unhealthy. So maybe this could help them. Maybe it could help their mood. Maybe it's a double whammy. It could help their mood and also help to bring their blood glucose levels down and balance them out. So I was wondering what else this diet could do. What else did the research say? So I went off on a bit of a quest, and I came across this paper, and I love sharing this paper with people because it really shows that we've had a lot of this research for a really long time. And if we've had this research for a really long time, we can we can be more confident about the fact that it may work, right? And also more confident about the fact that it's not just a blow-in, it's not just a fad. If done appropriately and properly, it can be really powerful. So this is a really cool study. You might not know anybody with schizophrenia. Okay, but this is a study that was done back in 1965. They took some women who had treatment-resistant schizophrenia. So again, remember, treatment-resistant means they had tried lots of different medications and lots of different therapies. They were not getting any better. They had noticed that the individuals started to have carb cravings before their illness got worse. So before they started having hallucinations and delusions, they had a lot of carb cravings. And there's research even back to the 1920s, so again, 100 years now, showing that people with schizophrenia have issues with utilizing and metabolizing carbohydrates. Okay, so they struggle to metabolize potatoes, rice, pasta, these carbohydrates and sugars. So I say 1958 here, but actually the research goes all the way back to the 20s. Now, this is really interesting because some of you might be thinking, well, I thought that all mental health conditions were due to a neurotransmitter imbalance, a chemical imbalance, or I thought that they were genetic. That might not be the case. So they took the ketogenic diet and they gave the diet to 10 females. The females continued to do their usual treatment that hadn't been working up until that point. And what they noticed after 2 weeks was they had a significant decrease in symptoms. So nothing else had been working. But in 2 weeks of giving this diet, they had a significant decrease in their hallucinations and delusions. Then, when they reintroduced the diet, the standard diet, in 7 out of 10 patients, their symptoms came back. So their hallucinations and delusions came back, simply by putting them on a ketogenic diet and reducing the carbohydrates that they seem to have a problem metabolizing. Of course, there's limitations. It was only 10 people, but they were treatment resistant and nothing else had worked for them up until that point. So that's exciting. That tells us that there might be an approach here that we can use to help people. And yes, this is schizophrenia. What about other conditions? Well, this is, as I'm going to show you in a moment, this is proving to be bring quite positive outcomes for a lot of different mental health conditions. So I got excited because I felt like I had found something. So I went off and I did my PhD and I looked specifically at ketogenic diets and depression. Because, like I said to you, you might not know anybody with schizophrenia, but I'm sure you know somebody with depression. If it's not yourself, maybe it's a family member or a friend. And so I decided I would look at that because if I could find something there, if I could see if this would work, then it would prove really positive for people. So what did I find? Well, a little bit of background as to what I did. I took a low carbohydrate diet. So this diet is slightly higher in carbohydrates. You're probably more familiar with a low carbohydrate diet. It's predominantly eating real food. You're just cutting out a lot of the sugars, a lot of the chocolate, the crisps, etc., and reducing some of the amount of potatoes, pasta, and rice, and you're low carb. So I did this with people who had depression, and then I also did a ketogenic diet. Now have a read of these quotes. I'm not going to throw numbers at you because I think that the quotes from people are way more powerful. Okay. And this is bringing out things that I was not even looking for. People started to sleep better. They said it was easy. They said that when they left work, their confidence was rock bottom, but now they feel like they're coming back. They feel like they can concentrate better. You know, they're able to read for longer. They feel like everything is much better than before. And for anybody who likes Blur, the band, you might like this quote. So it's all about the song Park Life, where it says that you should cut down on your pork pies and get some exercise. And it talks about the birds and it giving the individual an enormous sense of well-being. But this person, Mark, felt like it should be called Pork Life instead of Park Life because he just had an enormous sense of well-being when he was doing this intervention. And so I could sit here and say 20% of people did this, 90% of people did that. And I am going to show you some stats like that in a moment. But these stories are individual people who did this approach and who feel better. They're able to go out about their day, whereas before they were not able to do that. They didn't have that get up and go. If we have a closer look at some individuals, you can see before this individual was beginning to worry about not depression itself, but just being in a rut, just feeling pretty hopeless, not having that meaning and purpose anymore. And they couldn't figure out what was wrong with them. This person also didn't have a diagnosis of depression. They just had a lot of depressive symptoms. So this is somebody who would not be included in that 1 billion that I mentioned at the beginning. This would be somebody sub-threshold. And yet after the 12 weeks, they felt a lot more positive and cheerful. It had given them more of a positive outlook and helped them focus on their objectives. Who doesn't want that? When we have a closer look then at the psychological improvements and the physical improvements, we can see on the left-hand side, we have increased self-esteem, motivation, positive outlook, control over decisions made, overall psychological well-being improved, concentration, confidence, sense of reward, and meaning in life. And then on the right-hand side, things that we would expect based on the type 2 diabetes research that we have. So weight reduction, cravings have come down, hunger has come down, people even reduce some of their pain medications, their digestion improved, sleep, acne, and energy all improved. So for something that is relatively low risk, if implemented correctly, this is not another medication. This is not something intrusive. This is changing the way that you eat. This could be quite powerful for some people. So what are other people finding? That's me. That's what I found with my research. But what are other people finding? Here are the stats that I said that I would share with you. So some of these are a little bit difficult to understand out of context, but if you want to go and have a look at these papers in particular, you can take down the little note at the bottom there, put that into Google, and you'll find the paper and you'll find the poster. But what we have here overall is the results of some of the randomized control trials, the big clinical trials, using ketogenic metabolic therapy for mental health conditions. So over on the right, you have stats like 43% clinical remission. Now, it's really difficult to get people who have a mental health condition into remission. Okay, I shared with you that there's 30% of people with depression and bipolar disorder that are treatment resistant. Treatment resistance runs across all mental health conditions. If you think about your loved ones, people you know who might be taking medications, it's often that they are on those for a very long time, right? So it's not common to see clinical remission. So to have 43% clinical remission in these studies is really, really encouraging. Then we've got 64% of patients discharged on less medication than when they started. So again, often if you think about the people you know who are taking mental health medications, they're either on that medication indefinitely or it might be increasing. And so it's rare again for the medications to come down. One of the most interesting ones that one that I think would be quite interesting for you is that in some of these studies, the average weight loss is about 10%. And this one in particular is over 4 months. And why I find this interesting is because there is now, I think it's available on the NHS, but there is now a new gastric balloon that you can get if you're struggling to lose weight. And the research there shows that over 4 months, you can have a 10% reduction of body weight. And even with ketogenic metabolic therapy, so without that intervention, but with a nutritional intervention, you can also, or these individuals saw 10% reduction of their body weight. So that's interesting if you're thinking about things from a weight loss perspective. But overall here, all of these statistics are a bit difficult to understand, right? Compared to looking at the quotes from people and their individual lives. But all of these statistics are showing very encouraging results for this as an intervention. Now, this is one that I always like to share. This is a study that was done in France with 28 people who had treatment-resistant illness. So they had depression, schizophrenia, bipolar disorder, and they were put on a ketogenic diet. And every single patient saw improvements in their symptoms. Up until that point, they were treatment resistant. Again, just to remind you, that means that they are not seeing any improvements whatsoever with their current treatment for long periods of time. And after this intervention, every single one of them saw improved symptoms. Nearly all of them lost weight. We know that to be true from all the other ketogenic diet studies, that you can bring down weight quite easily. 64% were discharged on less medication, as I just shared with you, and 43% achieved that clinical remission. So again, this is very, very encouraging. All of these people with treatment-resistant illness seeing improvements. Now, this is exciting. This is a pilot trial that was carried out in Stanford University in the US, looking at bipolar disorder and schizophrenia. Now, again, you can see 10% average weight loss, 100%. So every single person on this trial reversed their metabolic syndrome. So if you think about what you know so far about metabolic health and what you've been learning about metabolic health and how important it is to make sure that you have good metabolic health, every single person reversed their metabolic syndrome here, which is extremely, extremely exciting. On the right, you can see some quotes taken from the people on this trial. So since being on the diet, I haven't noticed any significant anxiety levels or attacks, and I've been able to work through basically everything that I've come across. I can tell you that I've never felt better than I have since using ketosis, and it worked far better than the lamotrigine ever did. Now, lamotrigine is a mental health medication, so they are saying that it worked far better than that did. Now, they're suggesting that they are doing that instead of the medication, and I, along with other people in this area, are saying we can simply look at this, hopefully, as an adjunct. We're not saying to swap one for the other, but we're saying that you might be able to do this alongside your current treatments, and you might be able to see improvements. Okay, so we've spoken a lot about bipolar disorder and schizophrenia and treatment resistance, and you might be thinking, well, I don't know anybody with these conditions, and I'm not familiar really with the term treatment resistant, but perhaps you do deal with brain fog and anxiety, social anxiety, low mood, depression, suicidal ideation, intrusive thoughts. Maybe that's something that you've been dealing with, or you know somebody who has been dealing with. Now, here's a study. This came out recently, and this is reflective of what I see in clinical practice and what other people see in clinical practice too. Complete remission of depression and anxiety using a ketogenic diet and ketogenic metabolic therapy. No longer getting overly hungry, and this individual found that they no longer eat without realizing that they're eating. So there's a lot of that in the research showing that hunger and cravings come down, and that happens very, very early on. This person could ignore sugar cravings completely, which is a bonus, and overall they just don't have anxiety and depression anymore. They just notice that they're happy all the time. Okay, so again, these people were diagnosed with anxiety and depression, and they saw complete remission. What about outside of research? I've spoken a lot to you about research, and that's all great. Maybe you're thinking that all these people were put in a white box and fed the ketogenic diet, and you're thinking, well, how can you do that in real life? So what about real life, and what about real clinical practice? What does that look like? Well, welcome back to my cartoons. These are cartoons, yes, but these are the results of some of my clients. So here we see somebody who had mild depression and moderate anxiety. So you can see there PHQ-9 and GAD-7. These are just measures of depression and anxiety. So mild and moderate when they started. After 9 weeks of using ketogenic metabolic therapy, their depression and anxiety came all the way down to no depression, no depressive symptoms whatsoever, and 1, so minimal anxiety. Now, if this was a drug, the drug needs to see a drop of 4 or 5 points on these scales to say that it's clinically meaningful and that it's working. And we can see here that the numbers dropped from 9 to 0 and 11 to 1. So yes, this is clinically meaningful for this individual. On the right-hand side, we can see somebody who had moderately severe depression and severe anxiety, so much higher than the lady on the left. And after 4 weeks, both of those came down to moderate levels. And so again, these were both clinically meaningful improvements. And so in such a short amount of time, to start to feel some relief, even to have the possibility of feeling some relief, it's surely worth trialing something like this if you can do it in a safe manner. So how does it work? I'm not going to get into the weeds with you about mechanisms and things like that, because frankly, you don't need to know all of the mechanisms, and we don't know all of the mechanisms either as researchers. What we do know is when we think about the root cause of mental illnesses, so all the different conditions that you can think of, they have about 6 different root causes. Some of them overlap, some are present in higher levels than others, and so on. But pretty much everybody can agree that these 6 are the root causes of most, if not all, mental health conditions. Some of those you probably will have heard of before, others you won't. That's okay. It's not that important, okay? But the difficulty that we have right now within the mental health sphere is we don't know if you have depression, we don't know with certainty whether your depression came from oxidative stress or insulin resistance or insulin resistance and oxidative stress. We don't know. We could probably gather a couple of ideas. We could probably say, oh, well, because of this, it's probably likely that you developed depression because we can see that that happened, but we don't know for sure. Okay. And this is why it's so difficult to properly treat people with mental health conditions, with medications and therapies, because we don't always know the root cause, and the root cause might be a combination of these things. So it makes it tricky for us. Also, when you then think about the medications that people are taking on top, a lot of those medications have negative metabolic effects, but also have side effects, as do most medications have side effects. And so it makes it really difficult to treat, as I said. What is very exciting and encouraging is the ketogenic diet and ketogenic metabolic therapy can improve every single one of those root causes and offset the side effects of a lot of those medications. So there is research, I'm not just saying it, so there is research to show that the ketogenic diet can improve all of those. So it no longer becomes a question of, well, what is the root cause of this illness? Yes, that's interesting to try and find out, but it might take a long time. And in the meantime, what you could be doing is cleaning up your diet, moving to a low carbohydrate diet, and then maybe moving to a ketogenic diet to see if that helps while you're trying to figure out the rest of it. So it's not a cure-all, right, by any means. It's not a standalone treatment, as I mentioned, and we have a lot of research still to do to see exactly who it works for and who it doesn't. It's a piece of the larger puzzle. okay? But it does appear to be extremely powerful when it comes to treating mental health conditions. So if we try and think about this in a different way, this is what I like to call the metabolic bucket, okay? So this is us. This is you and I. We've got medications coming in the top. So we've got mental health medications coming in, and then we've got talk therapies coming in. Maybe we're doing some CBT, or we're seeing, a therapist online or something like this. And these are coming through the top. But you see, there's a lot of holes in the bucket. And as the medications and talk therapies come in, we're losing a lot of water and we're losing a lot of that. We're not able to hold on to it all. And this is because we have a poor metabolic foundation. Okay? If we start to fix metabolism, if we start to look after our metabolic health in all the different ways that you are learning, right? So all the different ways we are learning about improving metabolic health. If we do that, you can start to seal up those holes in the bucket. And that means that the water stays in. And that means that those medications that you are taking are more likely to work, and that those talk therapies and the CBT and the behavioral change, all of those things that you've been doing are more likely to work because you have a good, solid metabolic foundation and you have the space and the ability to utilize what you've learned and to access and apply what you've learned through talk therapy. Another way of looking at this is a simple pyramid, okay? 3 tiers on the base, the bottom, the foundation, just like a house. The foundation here is ketogenic metabolic therapy at the extreme end, but it may simply be a clean, low carbohydrate diet, removing the ultra processed foods, sticking to real whole foods. And then if you're not seeing full benefits, you might move to ketogenic metabolic therapy to get the full benefits there. But what we have is a strong foundation that we have used nutrition to form. Then the next layer is other metabolic therapies. So things like light, movement, exercise, getting out and about, really good sleep, making sure you're sleeping well, moving away from screens, all of these other things that you've probably been hearing a lot about whenever you open the newspaper or open your phone, you're reading about these things. So these other metabolic therapies or other health pillars are extremely important too. They come above the metabolic foundation because if you don't have that strong metabolic foundation through nutrition, you have holes in your bucket. So strong metabolic foundation, then other metabolic therapies, and then you have treatments for ongoing issues at the top. Once you've addressed the first two, if there's anything residual left over, anything that you're still struggling with, any symptoms that are a bit weird, or any kind of trauma things that you need to deal with, that's when you bring in the extra medications or the talk therapies, or perhaps you need to see somebody specific because you have a lingering concern. But the metabolic therapies can fix quite a lot of the symptoms first, and then anything left over you can go and you can address separately. So we've covered a lot of ground here, and it might still sound quite abstract to you, like the terms are still a bit weird, ketogenic metabolic therapy, and it also might seem a little bit out of reach. You might be thinking, oh, well, doesn't it cost a lot? Or, I couldn't possibly do that. Or, what about social situations and so on? I can tell you, because I've been helping people do this since 2017, that all of those things can be overcome. And actually, it turns out that the amount of money that you spend eating this way can work out the same or even cheaper than how you currently eat. But anyway, that's an aside. How can you make this work? So the first thing is just starting small with your lifestyle. Looking at your current diet, being honest with yourself, probably not we're recording this in December and doing this live in December. So, I mean, if we're thinking about Christmas time, it's going to be a bit tricky this month. But even if you were to start today, you would just start to make better choices. And so look at your current diet and you start with one small change, one actionable change. It might be that you do not put your hand in the roses tin this month, and that's the only small change. Whereas previously, your hand might have been in and out of that box every time you walk past it. Or anytime you get given, gifts or sweets or cakes or anything like that from visitors, maybe you put those to the side and you say, I'm not having those. You just pick one small change and you start to implement that. And then once that becomes a habit, then you start to say, okay, what's my next small change? You have to break it down and do one thing at a time. The other thing that's very, very important is to get the right education. Now, I don't mean going on fancy courses and I don't mean spending a ton of money trying to figure out how to do this. There are a lot of resources online that you can check out that will give you good, solid, trusted information. So you can come to ikrt.org or you can go to metabolicmind.org. Metabolic Mind are currently they are behind a lot of this research, but also they put out some fantastic videos and blogs on how to do this properly, how to do it efficiently and safely and effectively as well. So I would check out both of those. Also, these are my top 2 recommendations of books. You can get these as books or as audio books or on Kindle. The first is called Brain Energy, and this is a book by Dr. Christopher Palmer. And the second is a book by Dr. Georgia Ede called Change Your Diet, Change Your Mind. So even if you don't change anything at all and you just want to learn more or you just want to know more, or perhaps you have a loved one or a family member who you think this might be helpful for, I would start with the books. I would pick up the books and just give them a read in your spare time. Okay, and just start there. Then, once you're ready, I would look for some support because it's very, very tricky and very, very difficult to do these things on your own. And if I think back to my research, some of the reasons, or one of the main reasons why people dropped out of the research was because they didn't have a support network or accountability. The people who did, they were able to complete it. They were able to stay on. They had a sense of community and they were able to complete. So there's a ton of online support groups and you can also get one-to-one support if you need to. There's lots of different options and lots of different tiers that are available to you if you want to start. So here's my happy brain. How to begin. Again, I would say a step-by-step approach. Okay, so you can get benefits simply from cleaning up your diet. So that's one small action. So avoiding the sugar or avoiding the chocolate or avoiding your evening snacks, that type of thing, you can get benefits from that. So remove those ultra processed foods as your first step. Okay, switch to just real food that you recognize, food that your grandparents would have prepared for you, real food that likely doesn't come in a packet unless it's wrapped in plastic these days, but likely doesn't come in a packet. That would be the first step. Then, if you are feeling a bit better but not 100%, then you might consider following a low carbohydrate diet. So looking at some of those potatoes, pastas, chocolates, rices, and removing those or reducing them down so that your overall carbohydrate intake is much lower. And this will bring a period of blood glucose stability. So if you've been struggling with ups and downs and fluctuations, and perhaps your mood goes with it, following a low carbohydrate diet can help to just even that out and give you some more stability. But then if you're just not feeling that you're getting the 100% the way there, or if you feel like you have, or if you do have a condition that I mentioned earlier, then it's likely that a therapeutic ketogenic diet or ketogenic metabolic therapy might be the way to go. Okay, but you still need to do 1 and 2 first. It's best you don't jump into 3 because it's a big change overnight. So doing 1, then 2 if needed, and then moving to 3 if necessary. Ideally, if you're going to move to 3, you would do it with some guidance and support if funds allow. Now, I'm saying this because there are some conditions, specifically bipolar disorder and schizoaffective disorder, that if you move to number 3 on your own and maybe you don't quite know what you're doing, there can be a risk of things getting worse before they get better. And that can be a little bit dangerous, okay? Because we want you to be safe and we don't want you to have any symptoms that are unmanageable. Okay, so I would say specifically with those conditions, I would seek guidance and support if you're able to, even through the online support groups. Ask in your GP practice, ask online, see if you can get some extra support as you do that. Okay, but for other things, if you have anxiety or brain fog, this type of thing, you may be able to get some of those benefits without needing to get the additional support, though support is always welcomed. So we've come to the end now. Hopefully you've been inspired and maybe you've got tons of questions about, how this could even work in real life. But hopefully you are also just excited about the idea that this might be something that can help not only your physical health, as you know, but also your mental health. So here are some details on how you can reach me and how you can find me. Please feel free to do that, and I hope that you enjoyed listening.